I want to get some reaction from two other politicians this morning, Republican Congressman John Shadegg from Arizona, Democratic Congressman Vic Snyder from Arkansas. Gentlemen, good to see you both. Congressman Snyder, I'll begin with you. There aren't too many people who are disagreeing with the president's move. Do you think this nomination is going to be contested to a large degree?
I don't think so. I think it's a smart move, perhaps a predictable move by President Obama, but I'll give him credit. I thought President Bush's two best appointments were Dr. Bernanke as chairman of the Fed and Secretary of Defense Robert Gates. I think President Obama's two best appointments are going to turn out to be Secretary of Defense Robert Gates and Dr. Bernanke. So I give President Obama credit for, if he sees talent, he goes after it, even if they were former Bush administration appointees. So I think this is a good choice.
Right. Congressman Shadegg, I guess if you can't beat him, join him. Is that kind of thing?
Well, I guess it says that all of the criticism of the Bush administration last time around wasn't all correct. I'm not a huge fan of Mr. Bernanke because of the reasons that were articulated earlier. That is, too interventionist in the economy, getting us to spend too much money and borrow too much money, and some of these policies that I think have been too aggressive. But I think this was a move by the president that was seen as safe and as changing the topic, quite frankly, from what's dominated the news lately, which is health care, which is not going well for the president.
We're here with Leader Army and Art Cashin as well, and the conversation keeps coming back, guys, to this dynamic that who else? What better horse do we have to run right now, Leader?
No, I don't think so. I think it's the right choice at this time. And again, the downside of him going with someplace else would have been extremely difficult. So I have no problem with the choice. The question now, though, is will Chairman Bernanke come to terms with unraveling this whole myriad scheme of government interventions and get us out of that game and get the Fed back to its traditional role of some disciplined focus on the money supply.
I would agree with that, and I think there's some things Congress needs to do. We've given the Fed too big a role. We need to shrink that role. We have it trying to both manage the money supply but also promote the economy. Few countries elsewhere in the world try to give it a dual duty like that, which I think creates a conflict and causes these kind of problems.
May I add a comment in here? I agree with exactly what Mr. Army said. With regard to the Fed's power, when you go back several months to where we were standing on the abyss of something potentially really terrible, not only for our economy but the world economy, I was sitting in a meeting with Mr. Bernanke, and a small group of us were meeting with him, and I'm sitting there looking at this guy thinking, I wonder if he sleeps well at night, because he and Paulson at that time was Secretary of Treasury. You know, they were really trying to sort this out. So when I hear folks talk about pulling power away from him, I think we need to be cautious about taking away the ability for our government to react very, very quickly to potential future threats that are unforeseen.
I want to just, before we finish the conversation, I just want to get both of your thoughts on the healthcare overhaul proposals that are out there, because I believe, Congressman Snyder, that you've been holding a number of very rowdy town hall meetings. What's basically the public response to some of the proposals that are out there?
No, in fact, the last town hall meeting I had, sponsored by the Clinton School of Public Service, we had 1,200 people there. Very, very well prepared questions on all sides. There was not one harsh word spoken. So I thought it was a very, very good discussion. I think the challenge of us who are proponents of the plan coming out of the House now, and I know Mr. Shadegg has his proposals, which I think are commendable also, is we're not connecting with those people out there who already have health insurance and are saying, well, why do we need to do anything? I like what I have. And the point that we need to keep remembering is it's changing underneath us. Premiums keep going up for those of us who have health insurance. Policies get rescinded, pre-existing conditions, small businesses getting killed by increasing rates every year. And this is about those people, us people, middle-class people who have insurance, and we're not doing a good job of connecting with those people and discussing why we need to do something.
Do you think to get a bill passed, you're going to have to ditch the public option?
Well, it wouldn't bother me. I wouldn't lose any sleep about that at all, frankly. I'm not sure. I can see some of the merits of it. It's not clear to me why that has been latched onto as being somehow the definition of reform. I think it's gotten so much political heat for not much benefit, I don't think. If it were jettisoned, and then we could talk about, you know, the basic idea of this being a market-based discussion. I know Mr. Shadegg has some ideas about market-based discussion also. I think that would lower the temperature some, but I'm not sure when that's going to happen.
Yes, super quickly, Congressman Shadegg, I believe you've got a Republican proposal that you think might work. Tell us what it is, just very briefly.
I do. I think Vic is exactly right. We need to take care of pre-existing conditions, and we need to take care of the people who aren't covered. But he's right that the people we're leaving out of this discussion, and the people that I think the House bill does not help and actually harms, are the people that have health insurance now and like it. And we shouldn't be throwing out that part of the system to take care of the problems. And
well, we're not throwing them out, John. We're not throwing them out.
Well, under this system, what we're doing is putting them under the government control, because we're moving all control of health insurance to the federal government.
No,
Vic's right.
we're not.
Yes, we are.
No, we're not. We're not.
Let me finish. I didn't interrupt you.
All right, you're right. I apologize.
Where we agree is where we agree on a market. We do not have a health insurance market in America today. Last night on television, you watched 3 or 4 commercials for auto insurance. You watched no commercials for health insurance, because right now you and I as individuals can't afford to buy health insurance. It's tax-free if our employer buys it, but not tax-free if we buy it. That means we have no control over it. That means it's not a market. That means costs, as Vic said, are going to keep going up and up and up. We can do some market reforms. Let me buy health insurance. Let you buy health insurance on the same tax-free basis as a company, and you'll create a market. And also let us buy across state lines so that we're not forced to buy from 2 or 3 companies in just one state. That's not a real market. That's not competition. That's what's causing costs to go up for the 86% of Americans who have health insurance now.
I disagree with several things John said, but I'm going to leave it at this. He and I are in agreement. This problem is about people who have insurance right now and like it, because what's going on now is not sustainable. And I would love to have that continued debate for the next several weeks and months, because small business and large business and individuals who currently have health insurance and like it think they're okay. Well, when you sit down and talk with them, their premiums are going up. They're having to do exotic things as a small business. I talked to a small businessman.
And their premiums, Vic, won't go down if the government takes over this situation.
Yeah.
What they'll do is they'll get
me-
ration care.
Oh, John, I think you interrupted me this time. It's
Let me-
even.
yeah,
We're
yeah,
even
let me
now.
interrupt both of you,
Government's not going to take over. Government's not taking over, John.
We are awaiting the president's comments, and we'll have to make some time. A good exchange, though. We appreciate both of your time.
Thank you.
Congressman Shadegg and Snyder
Thank
joining
you.
us on Bernanke.